So recently I visited a monastery just to get some sort of spiritual retreat during the time of Lent, and I was asked to help consult on a case of schizophrenia. So I'm Dr. Anthony Collada, I'm a board certified psychiatrist. This video, I'm going to let you know a little bit about what schizophrenia may look like and the ways to treat it. Schizophrenia often presents as someone who's like hallucinating, maybe they're talking to people who aren't there, or maybe they believe unusual things like the FBI is out to get them, or that people are putting cameras in their house and watching them. It can be really bizarre and scary sometimes. Basically, schizophrenia, people get psychotic, meaning they don't understand reality or they have a misinterpretation of what reality is, and it goes on for a period of time. Sometimes it may happen just in a lot of stress, or maybe from drugs or some sort of adverse circumstances in life, maybe not sleeping. And then if these conditions go long for like several months down the road, like at least 6 months, then it can be a full-blown disease like schizophrenia. And when it gets to that point, it can be pretty challenging to treat. But we're not really sure why exactly this happens, but we think that it is due to dysregulation of dopamine in the brain, because that's where a lot of the medications work to try to help with these conditions. So there's too much dopamine in the mesolimbic pathway in the brain, and this can cause the hallucinations or delusions to come up. So really the causes or the treatment is going to focus on calming down this dopamine in this part of the brain. If you want to know more about these types of medications, you can just look at the antipsychotic medications. I have a whole playlist on that. Unfortunately, a lot of people who are going through this condition don't believe that they're sick, and they don't think that they need help. It can be very challenging for people around them, for family, for friends, how to deal with this. And so in cases where people get too sick, where they aren't able to take care of themselves anymore, like they're not able to do their own grocery shopping, they're not able to shower, you could admit them to the hospital against their will. Also, if people make threats of suicide or homicide, you can admit them against their will. Now this can vary from state to state, but that's a general rule of thumb in most states in the United States. And then in the psychiatric hospital, they can be basically offered medications. Now the patients don't have to take the medications. They can and often do refuse them. And then sometimes you can get a court-ordered medications over objection, meaning through the help of the legal system, the judge can order, yes, you need these medications to help you because you're so sick and you're not understanding what's happening. Other times the judge can let them go. And so in cases where there's court-ordered medications, when people refuse the oral medications, they can give an injection medication. So yeah, they can have staff hold them down and give them an injection. It can help with some of the psychotic symptoms that they're experiencing. It's really an unfortunate disease. Unfortunately, we don't have many ways to treat it.